Sara Combilizer has two modes. Normal mode brings the patient into sitting or recumbent position, lying down position. Standing mode makes it possible to lift the patient from lying down into standing position. Modes can only be changed using the control panel. Sara Combilizer positions are called stretcher, chair, and tilt table. Stretcher position is used to have the patient in a recumbent position and for lateral transfers of patients to and from a bed. With Sara Combilizer at a good working height, pull out the foot support or remove it completely. Pull out the spring lock and fold down at least the bed end shoulder support. Release the head cushion strap and place the strap beside the patient's head. Cross the patient's arms in a secure position. Gently pull and fold down the sliding aid underneath the patient. Gently tap the brakes to release them. Position Sara Combilizer parallel to the bed with a slight overlap over the mattress. Tap the brakes to apply them. Using the hand control, lower Sara Combilizer so its edge is on top of the bed edge. It should be slightly higher than the mattress to ensure an even transfer. Detach all safety belts on the bedside and fold them away. Place a sliding sheet on the bed. Make sure that the edge of the sliding sheet under the patient overlaps the edge of the sliding sheet on the bed. Attach extension straps if available. Fold up the bed rail on the non-transfer side of the bed. Caregiver 1 inserts hands into wrist loops, or, if extension straps are not available, grabs the handle of sliding sheet. Caregiver 2 ensures that the patient's feet are suitably positioned and free of obstacles. Caregiver 1 gently pulls the wrist loops to transfer the patient, while Caregiver 2 gently pushes the patient over to the bed. Fold down the bed rails. Place the patient's arms in a secure position. Gently fold out the sliding sheet underneath the patient. Never leave the bedside without folding up the bed rails. On Sara Combilizer, pull out the spring lock and fold down the shoulder support. For a smooth transfer, keep enough space by adjusting or removing the foot support. Fold down the bed rail on the transfer side of the bed. Place a pillow underneath the patient's head. Fold up the bed rail on the transfer side of the bed. Unbuckle the safety belts. Fold away the straps. Gently tap the brakes to release them and position Sara Combilizer parallel to the bed. Fold down the bed rail on the transfer side of the bed. Adjust the position of Sara Combilizer. Make sure the strap buckles are folded away. Using the hand control, adjust the height. Position the mattress slightly lower than the top of the bed mattress. Place a sliding aid on Sara Combilizer. Make sure the edge of sliding aid on the patient's bed overlaps the edge of the other sliding aid. Check that the brakes are applied. Caregiver 1 gently pulls the handles on the sliding aid to transfer the patient. Caregiver 2 stabilizes and gently pushes the patient over to Sara Combilizer. Gently roll the sliding aid out from underneath the patient at a 45-degree angle. Place the safety straps over the patient's body. Tap the brakes to release them. Move Sara Combilizer away from the bed so that a caregiver can access the side facing the bed. Tap the brakes to lock them. Fasten the safety straps. Check that the head cushion is comfortably in place and secure the head cushion strap on the back. If used, fasten the head safety strap. Attach the foot support. Raise and lock the shoulder supports. If needed, adjust them sideways. Ensure that normal mode is activated on the control panel. Chair position is used to place the patient in a sitting position. Check the knee safety belt. Loosen the belt during repositioning if necessary. A sliding sheet can be used to minimize friction for patients with frail skin. Press the chair button on the hand control to adjust the patient to any comfortable sitting position. Use the up and down buttons to adjust the height. Return the hand control to storage position. Press the tilt upright button on the hand control to tilt the chair into a horizontal position. Press the stretcher button to change from a chair to stretcher position. Press the down button. The Sara Combilizer must be in its horizontal and lowest position before change to tilt table position is possible. Press and hold the standing mode button on the control panel until the LED light has changed to a constant light. The stretcher can now be raised into a tilt table position by pressing the up button on the hand control. To move the patient from a horizontal recumbent position to a Trendelenburg position, press the tilt back button on the hand control. The angle can be adjusted from 0 to -25 degrees. Press and hold the tilt upright button to return the patient to a horizontal recumbent position. Sideways tilting of Sara Combilizer is possible in all positions, regardless of whether the patient is standing, sitting, lying down, or even in Trendelenburg position. To tilt sideways, press and hold the sideways tilt buttons on the hand control. The sideways tilting will stop for a few seconds at the center position. If the button is kept pressed down, the lateral movement will automatically resume. To adjust armrests, lift them slightly upwards and pull outwards until the locking pin is outside the stretcher groove. Position the pin in front of the tilt table groove and push the armrest bar in to lock the armrest in position. Remove armrests by rotating them slightly upwards and pulling them out of the base. Adjust the shoulder support by pulling the spring lock lever. Do the same to remove the shoulder support. Adjust the height of the armrest by pulling the spring lock lever and pushing the armrest up or down. Release the shoulder support by pulling the spring lock lever. It's advisable to hold the shoulder support with one hand when releasing it to minimize its movement. Secure the safety straps on the frame by locking the buckles. Press the spring lock to release and remove the foot support. Secure the safety straps for the patient. Position the head safety strap. Press one of the emergency stop buttons to halt operation. Reset the button by rotating it. This is the emergency function box. Press the main power switch and at the same time one of the following buttons. Up to raise the stretcher or chair, down to lower the stretcher or chair, stretcher to change from chair to stretcher position. Remember that when emergency functions are used, the built-in pinch protection does not work. To avoid pinching, keep hands and feet away from moving parts when using emergency functions. It's possible to manually quickly lower a patient from a standing position to a horizontal position. First, press the tilt table release button to unlock the tilt table position. A beeping sound indicates that Sara Combilizer is ready to be lowered manually. Depending on the original angle and the patient's weight and position, considerable effort may be needed for manual operation and can require 2 caregivers.